Hi, I'm Dr. Bhargava. In this video, I'm going to be sharing 20 cases with teaching findings. On this slide, we have multiple images from a patient's CT scan of the abdomen and pelvis. On the left, we have coronal and axial images showing haustra, and on the right, we have sagittal and axial images showing diverticuli. Frequently, trainees are confused between the two. Haustra are physiologic. They are equally placed and same in size compared to diverticuli, which are variable in size, is irregularly placed in the distal colon and are pathologic, can lead to diverticulitis. On this next slide, we have two CTs from two different patients showing consolidations. So here, the consolidation in the right upper lobe is without volume loss, so this is consistent with pneumonia. At the bottom, we have bilateral lower lobe consolidations with volume loss that you can appreciate here, consistent with atelectasis. On this slide, we have a great example of a large urinary bladder stone showing several layers of calcifications. Next patient presented after surgery, C-section, and they complained of abdominal distension, fever, with chills, and their white cell count was elevated. Here on their CT, we find that they have this large subcutaneous collection with foci of air. This is how the collection is visualized on the sagittal image, and here we can see the findings related to C-section. Here is their uterus, which is enlarged, and we have a C-section scar there, and right below it we see the urinary bladder. So here the diagnosis is an abscess secondary to C-section surgery, and the treatment here would be percutaneous drainage and antibiotics. Next patient had two different CT scans. These are both multi-phase studies at two different time points looking at a tumor in the liver, and the enhancement characteristics of the tumor suggest that this is a hemangioma. The teaching point is right here on this non-contrast enhanced phase where the hemangioma is hyperdense. On the non-contrast enhanced image, because the liver background shows steatosis and it is dark, compare that to this other study where the liver is not steatotic, and we find that the same hemangioma is ill-defined and hypodense. So remember, the appearance or attenuation of a lesion depends on the attenuation of the surrounding liver. The next patient's CT shows an incidental finding, a well-defined fat attenuation focus in the head of the pancreas. This finding is consistent with the pancreatic lipoma. These are rare, but once in a while we see pancreatic lipomas. This next slide shows two images, one in lung window and the other in soft tissue window. And the finding here is interstitial pulmonary edema, dilated left ventricle, and bilateral small pleural effusions consistent with congestive cardiac failure. This patient, these images are from CT of the abdomen and pelvis, and frequently when the lung bases are included, we find findings in the lungs, and here we have characteristics findings of CHF. Next slide shows a benign finding of a lung nodule in the left lung base, shown in the lung window and also in the soft tissue windows. This is a benign lung nodule because it has central dot calcification. Next patient had a pelvic transvaginal ultrasound to try to localize the IUD. IUD is normal in position. It is usually seen as a linear hyperdensity extending from the fundus down. If it is more inferior in the lower uterine segment or the cervix, we call that abnormal. The linear hyperdensity also causes this shadowing, which is also seen here on the axial image. The next slide shows a single sagittal T2-weighted image from a patient's MR of the pelvis. The uterus is enlarged. This is the endometrium. We see multiple scattered foci of T2 hypointensity. These are consistent with fibroids. The other findings include Nabothian cysts in the cervix, vaginal distension with ultrasound gel that is used as contrast, some free fluid in the pelvis that could be physiologic in a woman of childbearing age group, and we see T2 hyperintensity of urine inside the urinary bladder. Here we have multiple images from a multi-phase CT of the liver trying to evaluate this tumor in the left lobe. On the arterial phase, it shows nodular peripheral enhancement, and slowly on the delayed images, we see that the contrast fills in the tumor, like seen here, consistent with the hemangioma. Another multi-phase CT trying to characterize a tumor in the liver, which is heterogeneous and hypodense on non-con, shows heterogeneous arterial enhancement and portal venous washout consistent with a HCC LR5. The interesting finding is this linear extension from the tumor into the main portal vein. The portal vein is expanded. It shows arterial enhancement and portal venous washout consistent with a tumor thrombus or a tumor in vein or TIV. Here we see an abrupt cutoff between the tumor thrombus and some contrast in the portal vein. Next patient shows an interesting finding of a large left-sided inguinal hernia, and the hernia has a enhancing wall and internal fluid attenuation, and on the sagittal image we find that it's a part of the urinary bladder that has herniated into the left scrotum. On this slide we have two images where the findings are in the vascular structures. Look at normal vascular structures on the left side, normal superficial and deep femoral artery and the femoral vein. On the right side, we find that the arterial structures are fine, but the vein is enlarged and it shows a filling defect. This is also characterized on this coronal image. The vein is expanded with a thrombus, and there is some surrounding fat stranding and swelling of the right proximal thigh, findings consistent with deep venous thrombosis as seen on a CT. This next patient presented with some hyperdensity, which is ill-defined, involving bilateral lung bases. On the CT, on the SCOUT image, we find that this patient is obese, and we see this hyperdensity in lung bases. On the coronal image, we find that the lung density is secondary to fat deposition. On this slide, we have multiple images from a gallium-labeled DOTATATE PET-CT. Here's the rotating image. We were looking for a recurrent neuroendocrine tumor. There is no focal increase uptake to suggest somatostatin receptor avid neuroendocrine tumor. There is diffuse mild uptake in the soft tissues of the nose, corresponding to this part on the CT and the fused PET-CT image. This patient had a runny nose, and rhinitis led to inflammatory uptake of gallium-labeled DOTATATE on this PET-CT. Here are two images from a patient who presented with history of trauma, motor vehicle collision. And on the axial image, we find in a linear fashion in the subcutaneous anterior abdominal wall, there is fat stranding, and we see the same finding here on this coronal image. This is called seatbelt sign, which is an indicator that there's probably some visceral injury. So whenever you see this, pay more attention to the images and the internal organs. On this patient, we found a right acetabular fracture seen in the bone windows. This slide shows two interesting findings in the pancreas, incidentally seen in a patient. On this T1 FAT-SAT non-contrast enhanced image, we see normal high signal of the pancreas. In the head, there is a focus of low signal. Look at what happens to that on contrast enhancement. It enhances like bowel, so it's the second portion of the duodenum that is encapsulated by the pancreas, so this patient has annular pancreas. Also look at the pancreatic duct inserting into the CBD, a little bit more anterior to the CBD, and the CBD is shown here on the more posterior coronal image inserting into the duodenum. So the other finding here is pancreas divisum. So a good example of annular pancreas with pancreas divisum, a congenital developmental anomaly. Young female presented with hyperthyroidism. On the ultrasound, we find that both lobes of thyroid are enlarged and heterogeneous. And on the color Doppler images, we find that there is hyperemia in a symmetric fashion involving both lobes, suggesting Graves' disease. This patient underwent a I-123 uptake and scan. There is diffuse increased uptake in both lobes along with pyramidal lobe activity and a very high 24-hour uptake value, making a diagnosis of Graves' disease. This next patient had these linear hyperdensities abutting the uterus. And these linear hyperdensities are characteristic of Essure devices that have been placed as a contraceptive device in bilateral fallopian tubes. So be familiar with the appearance of Essure devices on abdominal and pelvic CT. Thank you for watching.